The prevalence of obesity is increasing at an alarming rate in many parts of the world. About 2 billion people are overweight, and one-third of them are obese. The plight of the most affected populations, like those in high-income countries in North America, Australasia, and Europe, has been well publicized. However, the more recent increases in population obesity in low and middle-income countries that are now increasingly being observed have been less recognized. Defining overweight. When people eat more calories than they use, their bodies store the extra calories as fat. A couple of pounds of extra body fat are not a health risk for most people. But when people keep up a pattern of eating more calories than they burn, more and more fat builds up in their bodies. Health problems of being overweight. Obesity is bad news for both body and mind. Not only can it make someone feel tired and uncomfortable, carrying extra weight puts added stress on the body, especially the bones and joints of the legs. Trouble breathing. Your larger body may prevent your lungs from expanding fully, and your breathing muscles may not work as well, so you can't take enough air in. Inflammation linked to belly fat may also affect your lungs. Extra weight can make asthma symptoms and COPD worse. Sleep apnea. This condition, where a person temporarily stops breathing during sleep, is a serious problem for many overweight kids and adults. Sleep apnea can leave people feeling tired and affect their ability to concentrate and learn. It also may lead to heart problems. High blood pressure. When blood pressure is high, the heart has to work harder. If the problem continues for a long time, high blood pressure can damage the heart and arteries. Fatty liver disease. When fat builds up in your liver, may make scar tissue that can eventually shut your liver down completely. Symptoms may not appear until the damage is done. High cholesterol. Abnormal blood lipid levels, including high cholesterol, low HDL cholesterol, and high triglyceride levels, increase the chances of having a heart attack or stroke when a person gets older. Osteoarthritis. More weight puts more strain on your joints and on the cartilage that protects the ends of your bones, causing pain and stiffness. More body fat may also trigger more inflammation. Just 5% less body weight will take pressure off of your hips, lower back, and knees. Type 2 diabetes. Obesity can affect the way your body uses insulin to control blood sugar levels. This raises your risk of insulin resistance and diabetes. Heart disease and strokes. Obesity makes you more likely to have high blood pressure and abnormal cholesterol levels, which are risk factors for heart disease and strokes. Depression. People who are obese are more likely to be depressed and have lower self-esteem. Kidney disease. Your kidneys filter blood and help control your blood pressure. But they can't do their jobs when fat builds up inside them and presses on blood vessels, or when the vessels that bring blood to them are clogged. That can lead to a dangerous buildup of waste in your body. Kidney disease can be a complication of diabetes and high blood pressure, yet it can also be partly a direct result of obesity. Other health problems of being overweight. Pregnancy issues. Cancer. Hardened arteries. Gout. Gallstones,